Good afternoon, everybody, and thank you once again for joining us on the Santa Cruz County School Superintendent's Educational Forum. We're here coming from Mr. Velásquez's office, not in his office, but this program is dedicated to his office so that we can show the wonderful things and highlights that we have in Santa Cruz County. This month, as many of you already know, is for the seventh consecutive year, so it's the seventh annual year that we have celebrated February as Early Childhood Education Awareness Month. We're kicking it off this week with the various activities, and today we have some superstars. We have some special guests with us today, and we're going to be talking about developmental disabilities in young children. This month, the committee, the Early Childhood Committee, has decided that we're going to focus on helping parents and young children and bring awareness to developmental disabilities in young children. And today we have a superstar panel and we're going to be talking about developmental disabilities with young children from pregnancy, even pre-pregnancy, all the way to 3 years old. So today we have with us, starting to my left, Cassandra Camacho from Healthy Families Program. She's the Healthy Families Program Supervisor located at the Child Family Resources. We have Dr. Tanya Henry, and she is head of the Department of Pediatrics at Mariposa Community Health Center. We have Yara Castro. She is Health and Social Services Manager at Mariposa Health Clinic. And we have Dr. Philip Williams, Associate Medical Director at Mariposa Community Health Clinic. So as you can see, we have a superstar cast. I'm excited about this, and like I said, we are going to learn a lot this afternoon. So the first question I have, I'm going to start off with you, Dr. Williams. If I'm a parent, okay, and I have a young child, obviously specifically from 0 to 3, what are some things that I need to look for the development of that child?
I think it's a great question. It's a very loaded question, so we'll kind of summarize. But I think the first thing to remember is that we really encourage for all of our parents, especially those at a young age, to have a really close follow-up with their pediatrician. Part of what we do in our visits is to look for exactly that. We not only, take care of kids whenever they're sick, but part of our job is to make sure that they're developing appropriately, and if they're not, then our job is to know what resources are available, and we help the parent to navigate through all of the different options. But in general, there's a few things that parents should look for. One is just, I always say, how is your son or daughter, how are they lining up compared to other people their age? So how are they comparing to other siblings? How are they comparing to cousins and others in their family? And anytime you see or notice any differences, and obviously we would like to know. The main diagnosis that a lot of parents always are worried about is autism. Not to get into a lot of technical details, but specifically for autism, it basically is composed of three different symptoms or 3 different areas. The first one is that kids with autism, they have impaired social interaction. So really, they just don't interact normally. Some parents say for kids with severe autism, it's almost like that I'm not there. They treat me as furniture. They really just don't have that engagement. The second thing is that kids, they have speech delay. So they just aren't talking normally, meaning that usually it's delayed. Kids usually start to say their first words. We like for them to say a couple of words by age 1. They roughly 5 words by age 15 months, 8 to 10 words by 18 months. So, if they're not meeting that, then we want to know why. And then the third thing is for kids with autism is that they have repetitive or stereotype movements. So a lot of times they do something over and over and over. So those are part of the questions that we're going to start to ask. And honestly, those symptoms you can really start to see at a very, very young age. Kids, even as early as 2 months. At 2 months, kids, they really should be tracking. They should really be focusing on parents. They should actually have eye contact. So if you don't see that, then we wanna know why. So again, the main thing is just that's what we're here for. Ask us any and every question. I should say too that autism, the term that we now use is called pervasive developmental disorder, and really it's a spectrum. So you have kids that, it could be very, very mild, maybe harder to detect until they get a little bit older. And then you have kids that are, that it's very, very obvious even at a young age. We do screen specifically for autism or pervasive developmental disorder at 18 and 24 months. So there's Dr. Henry can kind of elaborate more, but there's a screening test that we use. And basically it's a survey, ask a lot of different questions, and it's basically looking at those 3 different areas, and we try to see where the child will fall.
Okay. Dr. Henry, would you like to expand on that?
Yeah, no, I think Dr. Williams gave a pretty good overview. I think one of the things that I like to talk to my parents about is not all speech delay is autism. There are a lot more children that have speech delay that are not going to have autism spectrum disorder. And so just because your child has difficulty speaking doesn't mean they have autism. As Dr. Williams said, it's a diagnosis comprised of at least 3 different areas, restricted interests, repetitive behaviors, problems with speech delay, abnormal social interactions, things like that. A lot of things can cause your child to not be able to speak, including hearing loss. So in the newborn nursery, if you're born in the state of Arizona, your child will automatically have a hearing test done at birth. However, children can lose their hearing at any point in time during their lives or even as adults. And so if your child is not speaking as we expect, your pediatrician might order a hearing test. And a lot of parents say, well, my child can hear me fine. When I talk, he turns, different things like that. However, there are different levels of abilities to hear. So for instance, maybe you can hear, but it sounds like this, I can't really hear. Or maybe you can hear, but it sounds garbled, muddled. And so your child might be able to hear enough to kind of respond to you, but not hear well enough to make good speech sounds. And so if your pediatrician orders a hearing test, that's the reason why. And as we said, there's a lot of other things that can cause these delays. But the biggest thing is that if you notice that your child is not behaving as you would expect or as their peers, to let your pediatrician know. One thing we talked about, before this meeting was sometimes it can be scary as a parent to see that your child is not behaving as expected. They're not developing as expected. Sometimes you don't really want to hear that something might be going on with your child developmentally. I really want to encourage you that if you do, as a parent, see that something is wrong, don't hold that fear inside yourself. Just come, set up an appointment with your pediatrician. There are lots of things that we can do to help your child to maximize their developmental skills, even at a young age. And we're going to talk about that a little bit later today as well.
Perfect thing. Yeah, I can remember with my children, they didn't speak because they're twins, and so they weren't speaking maybe a few months. The exact month that the book says that they should be speaking. And I was like, no, it's fine. And my wife's like, no. And the natural tendency is to say, you should take a breath, right? But the natural tendency is kind of not ignore it, but just kind of like, no, it'll be fine, and believe that. But obviously my wife wins. And so we got him tested and everything. And it was fine, right? But I can definitely see that where a parent, and like I said, in my experience, where you don't want to see something wrong with your child. And so going to see somebody just confirms it, and that can be scary, right?
And then one other thing that I mentioned, so there are so many things that children should be doing developmentally, and it can be hard to keep track of it all. Dr. Williams and I trained basically for how many years? Bill, to be able to recognize developmental delays? Many, we'll say it's more than one. No, I'm just kidding. We trained many years. And so there are tools online and at your fingertips to help you kind of keep track of your child's developmental milestones. One of the tools that I love is a free application for your phone. It's called the CDC Milestone Tracker. And it is a free application, free for download. You can enter in your child's information, and the app will basically give you those checklists that we use at the visits and at home visits to let you know whether or not your child is on track, and to let you know if this is something that you need to speak about with your healthcare provider. So you don't have to remember all these things, but there's lots of resources. There's also a great website. It's called healthychildren.org. It is put out by the American Academy of Pediatrics. It is available both in Spanish and English, as is the CDC Milestone Tracker application. Free.
Thank you. And Cassandra, with your program, how does your program deal with developmental disabilities or with the parents?
Yes, I want to highlight that it takes a village to raise a child, and we're here to support you. Since you find out you guys are pregnant, we are here to provide that support. And having a newborn or just being pregnant can be very overwhelming with so many stressors going on. And it is very nice and kind to have someone from one of the home visiting programs in the community. It is amazing to hear that some parents don't know about the different home visiting programs. We have Los Padres with the Superintendent office, Health Start with Mariposa, Early Head Start with Head Start, and Healthy Families with Child and Family Resources here locally, just available to provide that support to new parents or expecting parents. And we provide child development activities. We provide developmental screenings. We go by what is best practice, and we follow the time frames from the American Pediatric Academy. And we screen children at least twice a year for the first birth to 3 years old, and once a year once the children are 3 to 5 years old. So if the parent wants more screenings, we provide those. Our practice is to give a copy of the H's and Stages questionnaire. That's the screening tool we used. We explain the parents their 5 domains to look up, and many parents like it because they give them like a guideline of what should I be working on, how can I stimulate this area that might be falling in the questionable spectrum. And when that happens, even though the parent feel like, oh no, everything is fine, just bring more activities, we create a plan to be intentional on the child development activities we're taking to the home, so we can provide that support to the parents. Because when parents know what is age appropriate and developmentally appropriate for their children, there's more empathy. They know, oh, that's normal, or that's like very normal to that aspect. And we really want to make sure parents are aware and they take informed based decisions. We, in our culture, sometimes we hear from so many people telling us, oh no, it's okay if the children don't talk until they're in elementary. But research shows that if we provide early intervention as soon as we can, there are more benefits, and we can help children to catch up in their education.
That's a very good point. This panel's talking about 0 to 3. What we talk about a lot this month also is the importance of having your child ready for kindergarten. A child that goes into kindergarten and it goes through these programs has a head start when they get into school, and it's a big deal. And one thing that I'm not going to take any more words away because I left Yada for the end because I know she has a bunch of stuff to say and she's good at batting cleanup. So, Yada, can you please talk a little bit about what you do at your program there at Mariposa?
So, like Cassandra was saying, we also have a Health Start. It's a home visiting program, and we also do Ages and Stages questionnaires and support, educate families, and everything that Cassandra said, we do as well. And all the home visiting programs I'm aware in Santa Cruz County do developmental screenings, and we all kind of follow the same process. If there's an abnormal screening, we'll refer to a pediatrician to rule out any medical areas of concern, and then of course we can make referrals to Arizona Early Intervention Program or other programs while doing a goal plan on working on those areas to improve. And making referrals to maybe other local resources like the family resource centers that have different classes and groups and opportunities for young children and parents to learn more, get their children back on track. So we all kind of work together We have different qualifying criteria. Our program, Health Start, is from 0 to 2 years old. Healthy Families, I think it's 0 to 5. Los Padres, 0 to 5 as well. Early Head Start, 0 to 5. So most of the programs are ready to make that transition into the school system, where if the child's about 2.5 years old, and if they're in Arizona Early Intervention Program, they will help with that transition to any special learning or classes that they might need once they get into the school system, which depending on your income, it could be Head Start or it could be another program within the schools or outside the schools, and they'll make that transition for you. If they're not in Arizona Early Intervention, any home visiting program and home visitor can help with that transition as well. But something that I want to also highlight is that we want to also look into, yes, definitely the red flags when you have a child, when you have a baby, but also what preventative measures you could take. We start from pregnancy, so our Health Start program, we begin as soon as somebody finds out they're pregnant. We could start home visits with them and support and education, prenatal classes, and all of that. So we're all really big on having healthy pregnancies, and that consists of getting regular prenatal care, good nutrition, taking care of any medical issues that might arise, and being in tune with your pregnancy, right? So bonding with your child begins during your pregnancy as well, and that leads to healthier outcomes at labor and delivery and postpartum. And when you have that newborn, like Cassandra was saying, there's a lot of stress factors that involve just with having the baby, and not adding a lot of the social factors, right? So my big thing is social services at the clinic. So there's a lot of social stressors that can add to that, right? So it's a whole nother layer. So the bonding piece with your child and being able to when you breastfeed, when you hold your child, and observing your child and creating that bonding and attachment, and that process is when you'll really see those red flags. And that is a huge preventative piece, because you'll be able to see, like they say I know it's a breast cancer thing, but early detection is the best prevention. It's the same thing here. I feel that early detection is the best prevention, right? So if you start noticing at those 2 months that your baby's not looking at you or certain, that is a time to start those conversations. So if you're bonding, during that process of bonding and attachment, you'll be able to learn more about your baby, his behavior, and be able to talk to your doctor sooner or your home visitor.
Yada, that's a great summary. I just want to mention one quick thing. So one thing that's super important, Yada talked a lot about the postpartum process and bonding with your baby. And for a lot of women, that doesn't go as expected. There are people more than we talk about that have postpartum depression, and for a fair amount of people, that depression symptom can even start while you're pregnant. So don't be afraid, don't be ashamed if you feel like you're not bonding with your baby as you expected, or you're not as happy about the pregnancy as you expected. Don't be ashamed or afraid to go to your provider and say, hey, I'm not feeling so good myself. Because there are resources, and this happens, and there's nothing wrong with you. It's important because healthy moms are great at promoting health for their babies. Some studies show that moms that have depression, depressive symptoms, their babies might have more risk of delays and different things like that, just partly because of, that attachment, that bonding is inhibited because mama is sick. And so moms, if you're feeling sick emotionally, don't be afraid, don't be ashamed. There's resources. Talk to your pediatrician. We screen for postpartum depression at our visits from 2 months to 6 months, and even sometimes before that. And so talk to your OBGYN, it's okay, just get it out. It's okay, there's help.
Also, one thing to add, breastfeeding can also be really, really difficult. I remember with my, before I had kids and, before I went into medicine, you think breastfeeding is just going to be this magical process that's super easy and it's so wonderful. And then I had my son and I realized this is really, really hard. So there's also a ton of resources available. Part of what Yada does, I think she has her department. They have breastfeeding support. There's educators. So it's not always as magical as you think, and that's normal. I usually advise my moms that it's going to be really tough, but it does still have a lot of benefits for baby, even for you. So please take advantage of all of those resources.
Yeah, go ahead.
I keep interrupting you, Chris. It's just because this material is so amazing. But I noticed that both you, Cassandra and Yara, mentioned a lot Arizona Early Intervention Program, and a lot of parents might not know what that is. Do you guys want to speak about that?
So Arizona Early Intervention Program provides further assessment to families, and when they go to the home, they do an assessment to see how the child is doing and how they fall with their milestones. And if they qualify for the program, they're able to provide speech therapy, occupational therapy, or connect families to any further support to help the child improve those developmental areas that might be falling behind.
And it's free. I like free.
I was just going to say, going back to the depression, we also not only do our home visiting programs locally, screen for ages and stages, we also screen for domestic violence, so we know that that is very big. So we all do sort of relationship assessments. We do the Edinburgh, we do depression screenings as well. And that helps open up the conversation with a lot of families and mostly moms, even though dads are also participants in all of these programs. The majority of the times who we're meeting with is moms, right? So we're able to really have an open conversation from kind of a peer-to-peer, because most workers, I could tell you, in all the programs, most of them are parents, and have that open conversation about whether it's during the depression screening and those results, the relationship assessment tool, the ASQs, and any other questions. And it really builds that rapport, and the family's able to engage with the home visitor and the worker to really open up if there are other stress factors that they might be holding back, and even any other issues that they should talk to their pediatrician or their doctor or anybody else. But they could kind of talk through that process and the worker can make the referral to follow up on whatever the resource or whatever the extra support or additional support is needed for that family. So I think that that's really huge in terms of what we all do, and making sure that those connections are made so that they have that trusting, neutral person that meets with them regularly and provides education, support, information, and engages in a neutral way, because we could get information from our family members and everybody else, and it could get kind of distorted in all of our minds, right? But when it comes from a neutral person that they have some evidence behind what they're saying and some trust, that level of trust, I think it really makes a huge difference in kind of peeling some of those stress layers that families have to really be able to get down and really connect with their baby or their child and see where they need to head.
Yes, and just to follow up with Yara, if the family would like support making the referral, we do ask for a release of information. All your information is confidential, and it is just to make sure we are connecting you to the service you're looking for and help you find the service available. And if there's any barrier, we can problem talk with you and see what might be happening. Sometimes it's like insurance. We can, discuss your situation, what's available, find those resources. If there's like any grant, what other health plans are available for you. Sometimes it's transportation. Sometimes it's like a kind of a language barrier to be able to set up those services available. So please, if you are going through some type of situation, don't hesitate to ask for help, to get connected with a home visiting program, because we are here. We are available and very happy to work with families and their children. So, thank you.
So I think you said it really well, Cassandra, when you said it takes a village to raise a child. What we're talking about is talk to somebody, right? I mean, if you have questions, talk to somebody. I know personally with my wife, the Family Resource Center, the U of A Cooperative Extension has family resource centers, 3 of them around the county, Rio Rico, Nogales, and Patagonia. And the fact that my wife joined those programs, they have wonderful classes, but the thing that she pulled from it is there are other people, other mothers, unfortunately not as many fathers, right? sometimes we aren't there as much as we should be. But with the same questions, the same fears, the same doubts, and she was just able to, I mean, you don't even have to talk. You can just listen and hear what other people are saying. And so very well said, and thank you for that. I have another question. In Santa Cruz County, what type of developmental disabilities are the most common? What types of things do we usually see around here in Santa Cruz County?
I'll start out. So I think, the most common that I typically see is isolated speech delay. So basically kids that just aren't speaking at their normal milestone. And like Dr. Henry said, that can be due to a lot of different causes. Usually it is isolated. So usually with speech therapy, it does get better. Another thing that we see is either gross or fine motor delay. So gross motor is basically big movements, so the kid may have a little bit of delay in their walking. Fine motor means that some of their smaller movements they may have issues with. So I think those are the most common. But again, for all of those, there is treatment. There's either speech therapy, physical therapy, occupational therapy.
Yeah, I would agree. I think far and away the thing I see the most is speech delay. And so just since we mentioned that, just to review, I know I don't expect anybody to memorize this, but just to know that by 2 months, your child should be probably cooing, like making those cute baby noises that no one else can make. By 4 months old, they should be kind of cooing back and forth with you, like a conversation, but cooing, making those noises, those kind of ooh, ah, things like that. They should be kind of laughing. By 6 months is when you're going to hear the ba, 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 ga, ga, mama. Those kind of noises. They said mom. Yes, those by 6 months, that's when you should be hearing it. By 9 months, usually they're going to start saying maybe like preferentially mama or papa and really mean it, like when they're calling mom or dad. And then by a year is when you should start to hear, okay, they have at least one more word. So maybe 1 or 2 words by a year. By 2 years of age, they should be putting 2 words together to make sentences. So that's big. And I'll give you a neat memory trick that I learned this in residency. By 2 years, so 1 year, 1 word. 1 year, 1 word. 2 years, you should be putting 2 words together. Okay, want milk. Let's go. Mom, no. 2 words together. By 3 years of age, your child should be putting 3 words together. Okay? 3 words. And by 4 years of age, they should be making full sentences. Everybody can understand them. So just remember that 1 year, 1 word, 2 years, 2 words, 3 years, 3 words together, and 4 years, full sentences, okay? And so if your child is not in that age group, even if their brother was slow to speak, even if their dad was slow to speak, even if mom was slow to speak, it means that they're kind of outside of the range of what we would consider normal milestones, normal development, and it's something that we should talk about. The reason I mention that is a lot of times speech delay does run in families, so it might be true that brother or sister didn't speak until they were 5, but how frustrated were they at 2 or 3? How many tantrums did they have because people couldn't understand them? So one of the things that I want to show is that a lot of times when kids have trouble doing something, it makes them frustrated, they avoid it, and it's not because they're a bad kid, it's not because they're lazy, it's not because they're chipelon, it's because they physically are having struggles. And so I think we can help with a lot of that. I mean, I know that you want your child to be the best they can be, absolutely, and that definition varies. But I would love, and I think you would love it too, for your child to be the happiest they can be. And so if we're able to catch these delays early and support them so that they don't get that frustration and those tantrums, I think you can save yourself a lot of heartache and your kid a lot of heartache as well.
I think that's a really good point, Dr. Henry. Another thing to remember is, by 2 years, roughly half of their speech should be understandable. And then by 3 years, roughly 75% of their speech should be understandable. And by 4, really all 100% should be understandable. Another mnemonic we learned in residency is, it's at 4 years old, it's 4 out of 4. At 3 years, it's 3 out of 4. And then at 2 years, it is 2 out of 4, 50%.
That should be the language that they speak in the house, right? Obviously, we're in a bilingual.
So, for instance, if you are, a lot of people are wondering, I live in a bilingual household, my child might be delayed because of that. And actually, it's not the case. It's great if your child lives in a bilingual household. Maybe they're going to have, the words that they need, but maybe some proportion is going to be in one language, some proportion in another. And I think we hear a lot of Spanglish with our kids, and that's pretty normal too. But they should still be, fairly understandable.
Okay, so even if there's two languages spoken in the house or in the community, they hear one, and at home they hear another, we should still go by those milestones. So let's say at 1 years old, we don't have that one word. What types of things? I always say we go and we get it checked out. But I mean, are there things at home like reading to your child? Those types of things. Does that help?
Yeah, I mean, I'll just quickly talk on reading. Reading is honestly probably one of the most important things that parents can do, and we really encourage parents to read at a very, very, very young age. I remember my newborn. I mean, I was already reading Harry Potter to him at that age, so we really tried to at a very young age. In Mariposa, we participate in the Reach Out and Read program. So, we give all of our kids books. There was a recent study, actually it's like 5 or 6 years old, but they looked at, it was a longitudinal study that looked at the success of kids. And one of the traits that they found in really most kids that were successful, most adults who were successful, is a love of reading, and especially reading at an early age. If you hear lectures by Warren Buffett or Bill Gates and others, they all credit with reading as their main, driver of success.
And I would like just to add, even before the baby is born, they're able to hear us. It's like being under the water. By the second trimester, your baby can hear you. You can start reading, start creating those routines are really gonna help you out to stick to them. Because once you have a baby, your world comes upside down. So having those routines in place before the baby arrives, it's gonna really make a difference. If you have like older children in the home, they can help you. Babies start recognizing the voices, and once they're born, those voices are very soothing to them. It's gonna help, to reduce the crying, to get the baby engaged in those parent-child interactions, and just do the parenting a little bit more smoothly. Babies don't come with a manual, but the support, it's there. So, there is evidence-based, and with the programs going to visit your pediatrician, there's always an ongoing education that you're gonna get, and the providers are gonna get to be able to provide the best support they can. Some of the conversations we have going into the homes and that we hear a lot is, oh yes, I let my baby watch TV so they can start learning new words, and just around that, it is very important to have those face-to-face interaction with your baby, because they are looking at your movements. And the TV, it's kind of far, and it's not the same being in person and being able to see how you're placing your tongue, how you're moving your mouth. That's really gonna help to increase the language and the communication, and how faster the baby is gonna be able to articulate words. And yes, being able to communicate, it's gonna help once they hit those toddler years, that tantrums and big emotions happen. So they're gonna have another way to show what they're feeling, and it's just a win-win situation.
And I was just going to add, reading was phenomenal, but it's also important, like that playing. So you went to the parent-child interaction. Any opportunity that you have to communicate with your child, right? Music. So playing music, singing with your kid, whether he's a baby, as he gets into the toddler years. If you take him grocery shopping and they're in front of the shopping cart, just pointing out, look at the yellow banana. Do you want a red apple? Making that eye contact while you're doing that, pointing things out, asking questions. I mean, maybe the 1-year-old's not going to respond, but respond for him or her. So having that conversation with your child at an early age will just you'll get into a rhythm and a pattern of communicating with your child as they grow up, which is critical even when they get to the teenage years. But it starts that dynamic, that parent-child interaction, that bonding, and of course, getting them on track with their speech and everything else in learning. But any opportunity that you have, just treat your baby, your toddler as another person, because that's what they are. Getting at their level, looking at them, talking, singing, dancing, having a conversation at any age, it is possible.
No, I completely agree. And I just want to reinforce that literally the more words that your child hears, the more that they're going to have. So as Yada said, make everything into a conversation. It's probably going to seem silly at first, but it's okay. Like, hey, we're going to go to the store. At the store, I'm going to get some milk. How about some eggs? You know, like it's going to sound weird and sound silly, but literally the more words that your child hears, the more that they're going to have. One thing I want to say is regarding the reading. So not all of us are good at reading. Some of us are unable to read, and that's okay. So just having the book and sitting with the book and making up stories about the pictures, like that's fine too. You know, if reading is not your thing, any kind of communication, talking with your child is gonna be great.
And I just wanted to add, going into the toddler years, you reminded me of it. You start trying to potty train, and of course the famous terrible twos, but obviously expanding that communication and helping them identify what they're feeling, how they're feeling. So using emotion words too when you're communicating with your babies and your toddlers really helps decrease maybe those tantrums and could make potty training easier.
And it goes quick, right? I mean, it's intense. Those first 5 years are intense, but they go quick, right? One of the most sweet things I've heard from my daughters is, "No, I got it, Dad." And just like, okay, right? I'm glad I don't got to do it, but come on, right? Right. So I know you guys are busy people. So there's just two things left. One, if there's anything else you'd like to say, you'd like to mention that we haven't mentioned so far. And then also the second thing is, for the parents out there, how do they get in contact with you? And we'll start with you, Dr. Williams.
Yeah, no. So, I couldn't do one of these sessions without mentioning vaccinations, and especially COVID vaccinations are available in this age group. So in that 6 months and above, there's two options, either Pfizer or Moderna. And they're basically very, very similar. They're what we call mRNA vaccines. They've been really well proven to work. We've given literally billions of doses of COVID vaccines worldwide. But for 6 months for Pfizer, it is a 3-dose series for those what we call the primary series. So they'll get the initial vaccine, they'll get the second one 4 weeks later, and then they'll come in 8 weeks and they'll get what's called the bivalent vaccine. Bivalent basically just means that it has information to protect against the old strain of COVID and also the newer strain, specifically the Omicron strain. And then for Moderna, it also is 3 doses. So you'll get the primary series consists of actually 2. So you'll get 1 dose. Again, 4 weeks later, you'll get the second one. And then they call the third one is actually a booster. So it's also with the bivalent, but it's going to be a bivalent booster. So all in all, it's essentially the same. You're going to get 3 different vaccines starting at age 6 months. Mariposa, we offer vaccines. The county also is still offering vaccines. So really, as soon as you can, come in and get your kids vaccinated.
And those vaccines are there at the clinic at both Nogales and Rio Rico, or just Nogales?
Correct. So currently we are doing them mainly in our Nogales clinic. We have certain days that we do vaccines. So basically call our main office and call our main number, say that you want to get vaccinated, and then we'll tell you all of the different options.
Dr. Williams, I've had some parents ask me about the cost.
So currently it is free. So COVID vaccines are still free. Your magic
We
word,
like
Dr.
free.
Henry.
We like free.
COVID vaccines are still free.
So I just wanted to say Santa Cruz County is a small county, a small community, and we're very lucky that we're one of the few areas that we all work very well together, and the different resources and programs. And I know Cassandra was talking about her program. I was talking about our programs, but the other programs that we mentioned, and not even programs that just work with families with young children, but across the board, any resource, any agency, we're all interconnected and we work very well with each other. So what I want to say is that for anybody who needs any type of support or connection, just to talk to someone, reach out to any agency in Santa Cruz County, to any organization, and they will put you in contact with who you need to be in contact with. And we all work very well together, that we know each other's resources fairly well, that we're able to guide and connect families the best way possible. So it's just a matter of everybody at home just connecting, calling, whether it's the clinic, Child and Family Resources, the county, other agencies, whether they're behavioral health agencies, whether they're even asking a police officer, they'll guide you the right place, because we all work very well together. So just ask someone for help or ask someone the question, and if they don't have the response, they'll connect you to any one of us that does.
Yeah, so speaking of that, I want to know what would you say to families as far as though, so someone is watching this broadcast and they say, well, I'm pregnant or I'm about to have a child. How do I go about getting started with a family visitation, home visitation program?
With healthy families, we enroll families prenatally until the baby is 3 months old. Sometimes if there are like other risk factors, for example, DCS involvement or any developmental disability, we are able to enroll a little bit passing our time with authorization of the state. The program, we are outreaching in the community, participating in different community events. It's also offered at our local hospital, Holy Cross. We have our family assessment worker going into the rooms. If the nurse show you the consent and you signed, we're able to go in and explain what we do. We are also able, we are located at 1827 North Mastic Way, just passing that street, going to Walmart. We get a lot of walk-ins, and when the families don't qualify for our program for whatever reason, we are able to send referrals to other home visiting programs. We really don't want any parent looking for services to not receive services. We get a lot of calls asking for child support. We offer that information to the parents or whoever who needs that information. But yeah, that's usually how we get the referrals. I know Yara, they also have their program at Mariposa. And do you guys mostly get the referrals from the OBYNs? Or?
So at Mariposa, we have kind of a systemic way of receiving referrals from our prenatal department, eligibility department. As well, we get direct referrals from providers, so our OB providers as well as some pediatrician providers. And we will get referrals that way. Again, walk-ins, other self-referrals or referrals from other agencies. We have 4 case managers, and each case manager carries a caseload between of average 38 families. So they have very good retention. So we want to make sure that we're providing good quality service. So if we really go really high on our cases, we kind of do a disservice to the family. So we want to be respectful of that. So as we have vacancies within the case manager's caseloads, we'll reach out and we prioritize obviously anybody with any high needs. But to participate in the program, you have to have at least 1 medical and 1 social risk after doing a screening tool.
Yes, we do follow the screening tool, and also I want to mention the services are free and voluntary, which means if you feel that program is not for you, you are more than welcome to discharge from the program. That's totally fine. Yeah, just, we have our Child and Family Resources website online. We have a way to get referrals that way. I know with the superintendent office.
So the Los Padres program at our office is located at the 1904 courthouse in the annex right behind. Also, you can call our office at 520-375-7940. I also want to mention the family resource centers that are located around. That's a wonderful resource also. So Yara, if they want information, they can just go straight to the clinic to
Yes,
see?
at any one of our sites. If somebody just wants to stop by, front desk should be able to guide them to the program. Otherwise, they could call our community health services department. So the clinic has several departments, and the programs, the community health programs are from our community health services department, which is where our Health Start maternal child health program is at. And they could call us at 375-6050 and also just ask for home visiting, or for any question, they could just pose it and the person on the phone will guide them.
Wonderful. And your phone number?
It's 520-987-6515. That's my direct cell phone. You guys can call, and I will answer and connect you to whatever service you're looking for.
Thank you so much. Is there anything else that anybody likes to mention before we sign off?
No, I think as always, I hope that after watching this video, you as families and as parents will know that we all just want to be your village. I mean, we want the best for you and for your family and your child. That's why we do what we do. That's why we get up for work every morning. And that we just want to be the support that you guys need to have healthy lives for yourselves and your children. So we're here, we're in your corner.
I just want to thank Superintendent Velásquez and also you, Mr. Young, for organizing these type of sessions. Really, both of you guys, you have a passion for kids, so thank you guys for your leadership.
And I'll make sure Mr. Velásquez gets that message. And I want to thank you guys for getting up in the morning and dedicating yourselves to our young children. We know the struggles that we have in this county as far as childcare and different things like that, and so you guys make the difference in our community. So thank you so much, and thank you so much for being here. Parents, no excuses. Here they are, right? And we mentioned other resources also. And the biggest thing I think one of the biggest things that we can pull from today is, if you have questions, talk to somebody. We're here for you, okay? So thank you once again for tuning in to the Santa Cruz County School Superintendent's Office Educational Forum, sponsored by Alfredo Velásquez, our Santa Cruz County School Superintendent. Thank you once again, and we'll see you guys next week with another educational forum focused on early childhood awareness. Thank you.